East and the West Coast. Welcome to the National Wraparound Initiative's June 2nd, 2015 webinar, an overview of TMS-WrapLogic Behavioral Health Record, BHR. I'm John Osowski, the project manager for the National Wraparound Initiative, and I'd just like to go over a few housekeeping announcements before we begin today's discussion. This webinar is brought to you in partnership with the Technical Assistance Network, so our thanks goes out to them as well. For best results, please check your settings in the audio pane if you're experiencing any audio problems. During the presentation, you will be able to send questions to the webinar organizers and our presenters today using the chat feature, but we're going to hold these questions to the end. And also, please note that this webinar will be recorded and posted on our website within a few hours of the webinar's completion. You'll see our URL for previous webinars is on the slide on the screen now, NWI.pdx.edu. You'd click on our resources icon and choose previous NWI webinars. And without any further ado, I'd like to turn things over to our webinar host today, Eric Bruns, co-director of the National Wraparound Initiative. Eric?
Thank you very much, John. It is a pleasure and a privilege to be with you all today. Talking about something very near and dear to the heart of those of us who are doing wraparound research and supporting wraparound implementation, which is electronic health records, health information technology, and their capacity to support implementation and outcomes of wraparound. John, just so you know, my GoToWebinar viewer is blank. Any sense as to why that might be, or should I go over to Kelly's? I think hers actually is showing the slide.
Yeah, it should be. I've actually advanced a little bit too far.
Do you see it all, Eric? Okay.
I'm going to go over to Kelly's side.
Yeah, it should be showing. Sometimes these have a little bit of a lag when they come up.
So sorry about the internal technical issues here, folks. So again, I'm Eric Bruns. I'm the co-director of the National Wraparound Initiative along with Janet Walker. And it is it's always helpful to have our program director for the NWI, John Osowski, running the show, keeping us on track. Today we're going to be talking through, we're going to be giving you an overview of the TMS-WrapLogic electronic health record that's been customized for use by wraparound initiatives and organizations. Go ahead to the next slide there, John. This is all of the endeavors that we undertake at the National Wraparound Initiative are in keeping and in support of our mission, which is to promote understanding about the wraparound model and to provide the field with resources and guidance that facilitate high quality and consistent wraparound implementation. TMS-WrapLogic behavioral health record software is a really excellent example of one of those resources that we have developed over now at least 4 years of effort. As you'll see in my little introduction and in the demo that we do, our proposal is that by using a wraparound care coordination specific piece of health information technology, that wraparound initiatives, wraparound implementing states and jurisdictions and provider organizations will have a resource that can help keep them on track with wraparound implementation, help improve communication among all of the participants in a wraparound process, and help managers and other decision makers have access to data on all of the children and families with whom they work, as well as their staff, to help manage and supervise. And all of these things are things that are tough to do in the real world of children's behavioral health services. And thus, we have developed this resource that we call TMS-WrapLogic. So go ahead to the next slide there. In addition to being a part of the work of the National Wraparound Initiative, TMS-WrapLogic is also a support for the work of the National Wraparound Implementation Center, which is, as many of you may know, something we launched about 1.5 years ago that formally gets training, coaching, and technical assistance to sites and states and communities out there to do high-quality, high-fidelity wraparound implementation. A partnership between Portland State University, the University of Washington, and the University of Maryland School of Social Work. And after I'm finished with the intro on the rationale and basic functions of TMS-WrapLogic. I'm going to be introducing Kelly Hyde, who is the CEO of Social Technology. And Social Technology's logo is displayed on this slide just to kind of represent that it is a true partnership among our three universities and Social Technology that has allowed us to develop an extraordinarily sophisticated electronic health record that's now available for licensure by wraparound initiatives out there in the children's services world. So with no further ado, why don't we go ahead and launch our first poll. This is something that helps us learn about who you all are and what your needs are, is to use some of these embedded polls. The first one's a real simple question. It just simply asks, who is with us today on the webinar? Are you a youth or family member or youth family advocate? Are you a representative of a provider organization in serving in a wraparound role like facilitator or parent partner, or maybe a supervisor or administrator? Are you a provider? Are you an evaluation or IT specialist? Are you a representative of a public system, state or local systems, or are you a trainer or a technical assistance provider? So just take 1 minute and we'll let everyone know who your colleagues are that are paying attention to the webinar today.
Great, and I'm showing we've got about 3/4 of the folks have voted so far, so maybe we'll give it another few seconds.
All right, so let's see who's with us today for our little hour-plus spin through wraparound technology. It looks as though pretty similar to our webinar we did when we first were developing TMS-WrapLogic. We have about 4% youth and family members, 48% providers, 8% IT folks or evaluators, 16% system reps, and 24% trainers or TA providers. So pretty similar breakdown to our last webinar on this topic, and that really helps us to know a little bit about how who's on today and what we should be talking about. So thanks very much. Feel free at any time during the webinar and demo today to put questions or comments into the chat box, and we will be sure to attend to those between now and the end of the webinar. So go ahead to the next screen there, John. What I'm going to do now for just about 5 or 10 minutes is talk a little bit about WRAP TMS and why the National Wraparound Initiative and those of us at the University of Washington Wraparound Evaluation and Research Team have invested so much time and effort along with Social Technology in developing this system. So what is TMS-WrapLogic? Just really in one 2-bullet slide, this is a comprehensive web-based health information technology system, or HIT system. The idea here is that we've integrated elements. Go on back there, John. I'll tell you when to advance.
It seems to be advancing itself. I'm sorry. Trying to work on it.
That's not good. Oh, shoot. We should have paid attention to that before. Okay, well, we'll deal with that. So TMS-WrapLogic integrates technology, evidence-based technology from different kinds of health information systems, including electronic behavioral health records, measurement feedback systems, and personalized health records. Functions of all three of those types of HIT are present in TMS-WrapLogic, which makes it a very comprehensive system. And the idea here is that TMS-WrapLogic is designed to assist implementation of the wraparound process and also other types of integrated team-based service approaches. So Social Technology would be perfectly happy to work with all number of different types of provider organizations and community and public initiatives that are coordinating care for individuals with complex behavioral health needs, not necessarily just wraparound. But that said, the variant that we call TMS-WrapLogic has very specific language and nomenclature in it that refers to the phases and activities of the wraparound process as defined by the NWI. Next slide. So why did we develop this system? We know basic research says that any kind of collaborative team-based care is going to be more effective when decisions are informed by reliable and relevant information. And so TMS-WrapLogic really grew out of the need to better adhere to the wraparound principle of being collaborative and outcomes-based. This is something that allows those who are using the system with families and youth to make sure that there's a record of the plan of care, the youth needs, the youth strengths, but also a place where progress towards those needs and towards achievement of the family's vision for the future can be tracked quantitatively for review by that team, as well as by supervisors and managers at upper levels. All of that kind of decision support, we know from research in health services, make outcomes for individuals with complex needs much better. So we know that that is an important part of coordinating care and doing wraparound, but frankly, it doesn't get done very often in the real world. So TMS-WrapLogic provides a way to keep track of all that information, as well as progress towards achieving outcomes and meeting needs. The other thing is that regardless of what kind of behavioral health or health services you're providing, we do need electronic systems to manage data and information. Well, if folks in wraparound initiatives are just buying stuff off the shelf, it is not going to be family-driven. It's not going to be strengths-based. It's not going to be team-based. And so we wanted to create something that was going to support provider organizations and others who are implementing wraparound with a system that actually does those basic kinds of electronic health record functions in a way that's in line with wraparound principles, as well as the standard stuff that we know all providers need to do, regardless of what they're delivering: documentation, billing, and high-level reporting on costs and outcomes. Again, TMS-WrapLogic does all of those things, but does it in a way that is in line with the wraparound principles and practice model. Next slide. So there are some systems that achieve these functions. There are some extraordinarily prominent wraparound initiatives that have developed excellent MIS and systems and EHRs that have been critical to their success in getting the amazing outcomes that they get for their kids and families. But what our observation has been is that when other wraparound initiatives in other states or jurisdictions are looking to use those systems, they don't always translate that easily to new sites or states. They were developed to support specific initiatives. So we have been learning from those places and those developers, and are trying to create a system that can provide wraparound sites with something that is field tested, usable, and model adherent, but also customizable to any unique, and we know they're all unique, wraparound initiative or care coordination initiative out there. So it was our goal. We set out and started working with social technology to create such a system that would be broadly available to the wraparound implementing field, which we know from our own research is at least 700 or 800 unique wraparound sites and initiatives across the country, serving nearly 100,000 young people. What we've learned is about 80% of these initiatives don't have an MIS that actually aligns well with care coordination or the wraparound model. So we wanted to create something that would do that for the field, and also was able to be customized to meet local needs, had training, help desk, and 24/7 backup behind it, was informed by ongoing research and usability testing, and also built in certain things that we know are critical for electronic health records, such as meaningful use certification, HIPAA, FERPA compliance, and so forth. So that's our goal here. Next slide. So to the end of creating such a system, and because it is so clear that the field of behavioral health needs systems like this that are configured to implement certain research-based models like wraparound, we've gotten support from several federal agencies, including NIMH. We currently have a research grant to study implementation and effectiveness of TMS-WrapLogic. And for those out there who are interested in learning more about how you can be involved in the research, this is something that I personally would be happy to have conversations with you all about after the webinar today. We've also gotten support from the Child, Adolescent, and Family branch of SAMHSA and the Center for Medicaid and Medicare Services. So we think that this all represents clear indication about how high of a priority this is for folks who fund and shape behavioral health services for kids across the country. Next slide. So my colleague, and we're both sitting in the same room today in Santa Fe, New Mexico. We've been meeting for the last day and a half about this project and sharing with one another all the exciting news about both the research and the development of the system. So my good friend Kelly Hyde here is going to give you a demo in just a few minutes, but here's an overview of the functionality before she shows it to you live and in person. TMS-WrapLogic provides a way to manage and access key information about the families and youth that you're serving, as well as other members of the team, the providers who are providing care, natural and community supports. So it maintains information on the individuals that are engaged in Wraparound, not just the identified youth, but all the members of the team and family. It maintains key documentation that the National Wraparound Implementation Center trains folks to collect and manage over the course of Wraparound. The plan of care, strengths, needs, and culture discovery information, the family story, the family history timeline, meetings and appointment times, meeting notes, contact histories, critical incident logs, and really critically, services and costs in a way that allow you to invoice and bill for services as well as track the costs of all services and supports received by any given family. So that's really important. We also, like I say, are tracking service processes and outcomes, including satisfaction, fidelity, and progress towards needs, and outcomes as assessed by standardized instruments, such as the restrictedness of living environment scale, and the child and adolescent needs and strengths. All of these things are built into TMS-WrapLogic and ready to go if you use the system. Next slide. So what's the point here of maintaining all this information or having one place to put all this information for each individual family? Well, it's intended to facilitate more effective wraparound for one youth or for the initiative of many hundreds of youth that are now out there. So at a family and team level, the idea here is that if you're maintaining these data and give people a permission-driven kind of system for getting access to the information, and that includes the youth and the families. They can log into the system and look at their plan of care. They can log into the system and communicate with their care coordinator or their family partner or their mental health therapist. They can put in ratings of their satisfaction or their progress. And we think that this is going to keep teams on track. It's going to aid communication and transparency and assist in documentation compliance for individual families, and make sure that any facilitator and supervisor knows which families are and aren't making progress, which ones need to be paid more attention to and have their plan revised in the next team meeting and so forth. Next slide. So at the same time, it's intended to facilitate more effective wraparound implementation for an initiative of many hundreds of youth. So at higher levels, you aggregate up all those data, and you can, and a supervisor will know who they should be zooming in on in their supervision session with an individual care coordinator. It facilitates evaluation of the whole initiative, of staff performance, of what kind of outcomes are being achieved by the families. And it allows managers and administrators to monitor implementation outcomes, service use, and costs. Which providers are getting built into plans and which ones are not? Which ones have best satisfaction? How much on average is care coordinator A spending on each plan of care versus care coordinator B? All of this information becomes immediately available at a high level. Next slide. It also provides a platform for entering, managing, and running reports for our fidelity instruments. Just as an aside there, the WIFI EZ, the team observation measure, data from those instruments collected by evaluators in your system can be linked to data on plans of care and other things that TMS-WrapLogic manages. Next slide. I'm going to let Kelly get into the details of this, but just to let folks know and to kind of let the slides reflect all of the features that are TMS-WrapLogic embeds. But this is intended to be comprehensive but user-friendly. Users log on by a single point of entry. It's web-based. Every user has a unique configuration, and each local initiative that's using WrapLogic has a unique configuration. And Kelly is going to, in just a minute now, show you all of these different kinds of functions, or a good number of them, how you can have a flexible number of roles and permission so that people can log in at the appropriate level of access. There's an individual workflow tracker that allows you to see what is and isn't complete for any given family, and so on and so forth. There's just a ton of features and functions. Next slide. Again, anyone with internet access can get access to the system at the appropriate level of access based on their permission, what level at which their permission has been set by the master users in the initiative. The user's home screen will be customized to show a summary of what's relevant to them. A care coordinator will see a summary of their current cases. A supervisor would see a summary of their care coordinators that they're supervising. The facilitators have a task pane for each youth that keeps them on track with needed documentation and the status of implementation for each youth. Next slide. I'm going to try and get to Kelly here. And finally, TMS-WrapLogic meets all HIPAA and FERPA requirements, and soon will be designed to meet certification as an electronic health record, both of which are very critical for them to be useful in any provider context. Next slide. So we've been doing research, as I said, with NIMH funds. Go ahead to the next slide, John. We have been testing the use of TMS-WrapLogic in controlled environments like laboratories, where we brought wraparound facilitators in and had them test drive the system, enter data, create reports, build plans of care. And we also now are having folks out there in the real world use the system with real families. And thus far, our average score on the standardized system usability scale from those from whom we've collected these data is a really very, very, very high 88 out of a possible 100 on this measure. The developers of the system usability scale, based on many thousands of pieces of data, set a benchmark for adequate usability at 68. And thus far, we've achieved a score of 88, or gotten a score of 88 on average for TMS-WrapLogic. So we're really encouraged by that finding. Go to the next slide. All along the way, we're also asking the facilitators that are doing this testing to tell us what they expected the ease of use of a system like this would be on a scale of 1 to 5, and then what they actually found it to be. And so 3 sample scenarios here: entering youth data, scheduling a team meeting, looking at the assessment data to understand youth progress, design and complete and review a plan of care. Folks were generally, feeling as though they would hope that the ease of use would be somewhere between 3.5 to 4 out of 5. And when they actually used the system, they were assigning ratings more like 4.3 to 4.75 out of 5. So again, good evidence that as the system has progressed, it is achieving good usability. Next slide. And again, if you would like to be part of the user testing, contact me. Those who are licensing use of TMS-WrapLogic in the field right now are fairly automatically involved in this iterative, federally funded user testing process. So with that, let's launch the second poll. And so you've seen a little bit of the laundry list of functions and of WrapTMS, and we're wondering, what data elements does your wraparound or system of care initiative IT system manage? And your options, you can check all that apply to you, but go ahead and launch that poll there, John, and take a minute and tell us what elements your IT system manages. And we also have options for saying that you don't have a system that manages any elements such as these, or that it's not applicable to you. If it is applicable to you and you do have some sort of IT system, You can tell us whether or not it manages service elements, whether it manages process data like fidelity or satisfaction, and whether it manages outcomes data. And right now, what I'm seeing with some folks voting is that a lot of folks don't have a system, or their role is not one that is part of a wraparound initiative. But for those of you who do have IT systems and know about its functionality, let's get a few more votes. We got to 70% here. It looks like folks are fairly evenly divided among your IT systems have service elements such as plans and services and strategies. A mix of that, a little bit less fidelity and satisfaction data, and somewhere in the middle outcomes data. So show the results there, John. And then we're going to hand this over to Kelly Hyde, Dr. Kelly Hyde, who is the CEO of Social Technology here in Santa Fe, New Mexico, and whose organization has been working extraordinarily hard. And I know this because I see the time of day that she's sending me emails and working with her programmers. Kelly, do you want to talk any more about the software as a service stuff now, or go ahead and start the demo?
I'll go ahead and start the demo.
Okay, so Kelly is now going to show you the system as it actually looks.
All right, Kelly.
Good afternoon, everyone. I'm going to go ahead and make myself the presenter. I thought we'd start today by my giving you a demo from two perspectives. The first will be coming into the system as if you were a facilitator, coordinator, supervisor, or administrator, and I'll focus more specifically on how the record flows from the perspective of those particular roles. And then with the time left, I'm going to show some of the administrative features that really highlight the flexibility of our particular record. The system itself is what we would call a software as a service. It's a subscription service versus an off-the-shelf package software. It is, as Eric previously stated, cloud-based and accessible to anyone who has an internet access. Upon setup, you will be given, your role within your organization and your permissions within the system would be established between our company and your administrative and clinical staff. In this demonstration, I've just logged in as a care coordinator named Colleen Lopez. Sure.
John, just want to make sure that Kelly's screen is being shown. It's not being shown on mine.
Okay.
Yeah, I was just about to jump in there. I'm not seeing it, Kelly. I'm sorry. I've made you the presenter, so.
There we go. How's that?
It's on here now, it looks like.
Okay. What I had just been saying is that everyone would be given a perspective login and given the ability to flexibly manage their login and user settings up in the upper right-hand corner. The system is, I kind of liken it to those nested Russian dolls. Each row has a set of permission, and there can be as many roles as need be for your organization, and what you actually can do within the system and what you can view will be based on those initial setups and permissions. I am in as Colleen Lopez. I'm a facilitator, and when I come in, I'm going to see three major aspects of the record that are of most interest to me. One is what we call the data that are on our clipboard, which is quick links into the most salient aspects of the record. And then I'll actually see my particular records of youth to the right. All of these are basically dashboards, and they can be locked and moved around. What I see when I log in, again, is going to be established upon setup by my administrative and clinical group. But what you will see today are basically the default settings that everyone sees. I can actually sort on different features. You can see I just sorted. I can sort by name alphabetically. We can set up your records to be driven off of thresholds, and you can see that the green highlighted records are those where there's been activity in a certain threshold of time, and the red where that threshold has not been met. So it easily allows you maybe to see those records that need the most attention, or clinically, if a supervisor goes in, they can too, just by color differentiation, see clients that meet the threshold criteria for record review. The dashboard allows the system to be highly data-driven. These are just placeholders again. I will show you towards the latter part of the presentation how this system allows users who have permission, probably more technical users in your organization, to build and publish dashboards using data variables within the system. These just show you placeholders for family satisfaction, youth placement, youth enrolled in WRAP. Others that can be added are relative to any aggregate or cut of data measured by the system, such as cost of plan of care, clinical thresholds, etc. The reminders, there's two levels of reminders. There's organization-wide reminders. We have a reminder builder that allows your organization to build reminders of most interest. As well, we have a standard set of reminders that you see in the drop-down that I'm presenting. All reminders then are associated with roles and or records managed by those roles. You can see team meeting, if I wanted to sort it, I'm not quite sure I have any team meetings in the future or set up in here, but I do, so I can see that team meetings, and all of these are red, which means they're past due. I can sort on anything really, new case assignments, etc. Reminders are pretty only limited to the extent to which you need to set up reminders, because there is a reminder builder feature that allows you to add to this core set. The clipboard dashboard reminders show up with all logins, and then outputs are assignment of particular data of interest to the user group. I'm going to show you these more saliently once we get into records. So I'm going to go ahead and move into the record. There's several ways to do that. I can move in through the clipboard. I can move in through the record link itself. I'm going to do that. I'm going to go into Esther. We're going to be working in Esther Hernandez's record today. And when I move into Esther's record, I'm going to actually, as soon as it loads, it's taking a little bit of time. When I do this as a handoff from another GoToMeeting, it does have a little bit of a lag time. And once I come in, now I'm really able to see all aspects of one unique record. This is Esther's record, and each record comes with a workflow. The workflow is the default set of features as defined by your organization that are relevant to the practice model and therefore relevant for data collection within the record. This is the default workflow aligned with the practice model high fidelity wrap. However, as we know from working with many organizations, this workflow may be incomplete for some and not complete enough for others. There is a workflow builder that allows you to realign aspects of the record. These are quick links then that allow you to go right into that aspect of the record. Your organization can set thresholds for what completion means, and it can show you updates. I can automatically, by pulling this up, see that this record's baseline set of data are 92% complete. There's 3 youth needs aligned with 3 billable strategies, and there's currently 2 members on the team. I can also link into any aspect of the record I want there. The dashboards, again, these are the default set, but they more or less show you the trajectory of the facilitator or coordinator assignment. Much of the language or lexicon you see is editable. For example, some people call this role a facilitator, others call it coordinators. There's ways for us to realign the language and also to show you how to change language in the record that makes it more consistent with your organization. So I can quickly see weeks in care. When there was a facilitator change, I can see the enrollment status, how many weeks were spent in pending and how many weeks were spent in other statuses that are, we have a default set of statuses that can be added to by you so that you can track the status of those records. More importantly, the data-driven decision-making aspect of the record allows you on the dashboard for any record to see your youth needs as operationalized in your plan of care against the progress, and you can see how the scales operationalized: 0, no progress, 2, 4, this need has been met to our satisfaction. And you can track that. You can see that at week 53 a new need statement was added, and you can track those over the trajectory to the end date of the need statement. Core assessments begin here, which really are a part of all of our offerings, which include family satisfaction mapped against satisfaction with progress, school-based outcomes against number of disciplinary events, community outcomes such as functioning in the community and number of juvenile justice contacts, and an assessment of residential outcomes, living environment, level of restrictiveness over the life of the record, as well as youth connections at baseline and currently, and then family connections baseline and currently. These are all placeholders. These are the default set. Again, we have a business objects report builder embedded in this record that would allow relevant people or even us to build additional views for you. The record itself, again, as Eric stated, follows the practice model of high fidelity wrap. Starts with a collection of demographic information. We also have a family portal that is much like the patient portal in traditional medical EHRs, where it's a confidential login where the family can message team members, receive messages, take assessments, and other aspects as needed can be added to the family portal. The demographics obviously are fairly comprehensive. The asterisks just denote those that are required to sign up a youth, and then the record could be assigned to a repository, for example, where supervisors go in and then assign to facilitators. There's many ways to assign the record across. These records can be transferred from one facilitator to another, or even within the same organization if you have different practice models and a youth moves from region A to region D, the record can easily be transferred in an overnight resource sharing capacity to that other facilitator. The demographics allow you to collect valuable information on school placement, language and insurance, custody information, and referral form, which really serves as a psychosocial assessment of sorts. Anywhere data is entered once and is required again, the system within the demographics sector of the youth, family, and team, it will repopulate those data for you. Again, I can use the workflow at any time needed to move strategically through the record. And the majority of customization at this point when we engage with an organization is around what needs to be in these 5 screens, and a lot of times around assessment and a little bit around plan of care. This is an additive record, so the record is added, the data on the youth are added. Once those are added, the family members who are added as a byproduct of youth data, I am the person who is the custodial, the custodial caretaker of Esther, therefore I'm automatically added as a family member. Additional family members can be added here. And then as we go along, the team member development occurs in this screen. So team members are added in several ways. The youth who is the youth's record, the youth themselves is added as a team member. The primary caregiver is added as a team member automatically, and Colleen, who is the facilitator, those 3 are automatically always added. The additional adding of team members is a relatively easy task. If an organization has a consistent set of team members that are be, that they often see the same equine psychotherapist or the psychologist or the school counselor, guidance counselor. Once that person is added as a team member, there is a team member repository that would allow any person in the organization to pick that team member off of that pick list. So a team member, adding a team member is as easy as picking the team member that might already have been added to another team and selecting the team member role and saving it. I'm going to try not to engage in too many direct data entry features, just because when I'm kind of on somebody else's GoToMeeting, it does tend to result in some lag time. So it's just a matter of choosing the variables, selecting the row. I'm going to say that this person's a mentor, and I'm going to save it. So the team membership can occur at any time throughout the course of the team. Team members can be added, team members can be removed, and at any time an active team member repository for an organization is available for use to be shared. Team meetings also can be scheduled from this capacity or from this actual screen, and you can see that those team meetings, you can see that there was an initial that's complete, that 4 were invited and 4 were attended, and then there's actual the capacity to add meeting minutes, collect meeting data, either through a worksheet you print out or direct data entry, which results in a report that outlines the intent, what has occurred at the actual meeting. And so those meetings can be scheduled as frequently as needed. The data that are available to be collected pretty much are derived from those aspects of the record that have been aligned with the record. So if I align core assessments or I align a CANS assessment to be collected every time the team meets, then those aspects of the record would show up in the meeting worksheet, as well as all of the need statements and the plan of care for review. I'm going to try to move into the plan of care here. I just wanted to give you a quick showing of a team meeting report and let you see that. Okay, it looks like maybe my pop-up or something. Let me continue, always allow, so I'm going to do that. I'm just going to try to do that again. Maybe that's what was causing it. And I'm not sure if this pop-up blocker is mine or through the GoToMeeting, so I'll probably just move on to the plan of care if we don't get this moving forward. The other aspects of the record are, as you see on your screen, there's an entire assessment section, which includes the ability for your organization to build assessments as needed. And we also have the core assessments, which I showed you in the dashboard. As well, there is a what I call license tool repository that we have available to assign to you, and those can include tools such as the CANS, the CASI, etc. I'm going to move on from this, or here we go. Maybe I'm getting somewhere. And so this will just show you. This just shows you the team meeting report. Again, these data are derived from data previously entered on youth demographics, team members, invited, attended. This is on a retrospective, and it allows you to add data, relevant data that can then sync with the record. You can choose also to use this direct data entry feature, which gathers those data of most interest to the team for review at the team meetings. As I was stating previously, while we were waiting for the population of the team meeting report, there are several aspects to the assessment. There's the core, which are those that are associated with those dashboards. There's also custom assessments. These custom assessments can be built by you using our custom assessment builder, or we can build them for you depending upon if you have resources to that yourself or not. And then we also have available, as I told you, the several license assessments that you can make available to you. One of the exciting features that we currently offer is a CANS builder, which allows you to design a unique CANS platform We offer, I'll show you that in a little bit. I guess I'm switching over there right now, but through one of the administrative settings, it allows you to select the CANS assessment that your organization uses, and then add on relevant other questions that may be unique to your organization. Those CANs and all the assessments then are linked to a set of what we call hard-coded reports that are available to be published. They present similarly to the dashboards. We also have a very unique family timeline that also creates a report. This allows for family history, documentation, and relevant critical events that then populates into a report. And we'll see if I can get this to pull up in a timely fashion, but you can just kind of get an idea that Esther Hernandez was born, and here is an example of her being adopted. But actually, I've seen these where they're quite lengthy, and you can actually view in print. You can save to a file, you can save to a repository within the record, or you can actually email. And I'm actually going to close this and get out, or just go back. So the assessments can be set up to be taken as needed on assessment schedules that are defined upon the setup of the system, and can be changed at will by your staff or administrative staff. Just realizing my battery. So now I'm in the plan of care, which is really where we start to see the alignment of this EHR with the high fidelity wrap. Each record has one plan of care. You can always view in print. This data check allows you to integrate any data that may have been changed or updated. You can set it for a manual check or a automated check of data that have been entered. You yourself can define what requirements you have for both demographics and the plan of care. And I'm going to just go right into the record itself. And I am going to look for my power source, because I realized that I might be needing that here in a minute. The plan of care is very comprehensive. We have a plan of care builder. This is the default. There's always a live plan of care, and then copies that can be sent out for signature or sent to team meetings. I'm going to go into the live plan of care. I'm good. The plan of care is broken down into modules, and you can kind of see by the modules the alignment with the principles of the practice model, high fidelity wrap. We do have a plan of care builder that would allow you to realign these and also add other aspects as needed. For example, one of our clients needs a transition-aged youth module, and so we use a builder aspect in almost all functionality within the system to allow it to be comprehensively flexible. I'm going to show you, so this is a lot of the team vision, team strengths. Any data, again, that has already been entered are then pre-populated based on your setup. So I require these demographics, and then I require these features to also be in the plan of care. The first time you add a plan of care, it asks you if you want to sync those data. And when you do, the plan of care then is automatically populated with data. The crisis plan allows you to add aspects of youth diagnosis. We have an integrated DSM-4, 5, ICD-9, 10, depending upon the history of the record, that you determine, we make available to you. You determine what aspects of the crisis plan and diagnostic indicators you want available, and then we make those available. We are submitting for meaningful use certification July 1st, which means we'll have a very sophisticated embedded e-prescribe feature that will actually take over this current medication aspect. So you'll be able to manually add medications that the youth is on, but also if your organization uses the e-prescribe features, this would automatically populate by virtue of an e-prescribe. Your history, I see some test data in there for both brief history, triggers, potential crisis, action steps, responsible persons. And then we actually have an aspect where you can add crises and assign action steps that can be a part of the billable services strategy that actually show up on the cost and service, overall cost and service of the record. So I'm going to actually, you can move this, we can go to the next page. You can use that feature to move the team mission. We also can populate in data from the assessment categories or assessments into the plan of care, and or for those assessments like the CAFAS, which is proprietary, we can make available an ability for you to populate in relevant data without having the whole assessment within the record. And you can see here the CAFAS and another assessment. It shows you the data over time, shows you the baseline. All these data then are made available to use to ask questions of your data through the report builder. The heart and soul of the record is really in the needs outcome strategy. I'll just show you one. Again, this is a little bit of what you saw on the dashboard relative to needs and outcomes. Esther needs to talk to someone about her destructive tendencies, completion dates, the ability to formally review and or delete. If I go into the review, it allows me to review and update the need accordingly and assign a progress rating. And these progress ratings are those same progress ratings you saw show up in that dashboard in the front of the record. So how are we going to direct efforts to assisting Esther in accomplishing this need? And there's the ability to assign formal and informal, or if you call them billable and non-billable strategies. This one is defined as Esther sees Dr. Drake twice a week to help her understand. And that's associated with a service record that is all pre-populated at the time of setup with your service codes and categories. We also have a claims adjudicator feature that would use these data then to adjudicate claims with Medicaid services and third-party billing sources. There's an aspect that allows you at any time to see how much money is being spent on any one need and any one service. It allows you to create referrals to providers selected. In this case, it was Dr. Drake. There's a customer report component that actually gives the youth and family information about this particular service. So I have a little map to Dr. Drake's office, and I have all the data that are necessary for Esther and her caretaker to see Dr. Drake, who also can be a member of the record and or can receive via email the referral for that service. Again, I'm going to try to find an informal. All these look like they're formal. You can kind of see how it works. There can be more than one strategy assigned to a need, and then within needs there can be tasks assigned, which also can be aligned to be billable as well. There's other data that are collected. These are team members and an administrative information sheet, and then information on the organization. If I go back to the beginning, what I can see is the current is always the active record, and then there's the ability to make copies and select type. I can see that these two bottom types have been signed, these two above them are duplicate and the rest are actives. I can actually send this out for signature. One of the new features that we'll be adding in the next month is the ability to sign in real time, like with a a laptop or a tablet at a team meeting. But the emailing of signatures is all based on a HIPAA and FERPA compliant system. John, I just wanted to do a time check before I move any further.
Yeah, we're we're at about 12:54 over here, and that gives us about 35 minutes left in the webinar.
Okay.
Yeah, Kelly, I think this is Eric. I always encourage folks, you know, that a lot of this can be a little overwhelming. Feel free to just shoot in questions if you have specific things you'd like to know about the software.
Okay. Yeah, that's a great idea. I'm going to try to stop with about 15 minutes left, so that gives us about 20 minutes. I'll just really briefly touch on some of these aspects so that I have a chance to give some attention to those larger administrative functions of interest. We have a pretty comprehensive context service note that actually can be used as a part of a claims adjudication process. In this demo is actually aligned with a Medicaid EDI exchange, and so most of those data for that Medicaid claims exchange are derived off of these service notes. So while we have a basic template of what's included in a service notes can be customized to meet your billing needs with your payee sources. We also have a tracking of critical incidents that can be added to your record, and a lot of these features, such as critical incidents and service notes, are really contingent upon what is needed by your organization. Some have a need to collect critical incidents outside of the service notes, some collect them within the service notes, some add them within the plan of care and the crisis plan. We also, each record comes with a document repository that allows you, it's actually a 25 megabyte storage space, which is pretty comprehensive unless you put a large file with a big graphic on it in there. But I can actually choose labels and choose files directly off of my hard drive to upload. And you saw at different times throughout the demonstration where I could actually save data from an assessment or a plan of care and send it to the document repository. The document repository in and of itself is accessible for a role who may have a view-only permission. So if you have an audit, you can send your relevant files to the repository, set up a role called, audit, and they would just come in and just look at the document repository. Each record has a message board. All team members have access to the message board. The message board works much like, an instant message system. Anybody on the team and the family and the youth have permission to send messages. Those permissions can be revoked if privileges are abused, as well. And so these are messages that also show up in the family portal, and the family can also send messages from that portal. We are going to be integrating this messaging system with external email, so I could actually send an external email into this messaging system. Right now it's all an internal system. We also have a youth record specific reminder builder. So if I want to add a reminder that says Esther is missing, please let us know if you hear from her. I can set it today, and I can select it to run today, and I can set it to everyone, to the team, and I can save and close it. So there's a record reminder for all, a record reminder builder for all records as well. There's a reminder builder within the overall structure of the record. At this time, I'm going to log out really quickly, and for about 15 minutes, I'm going to come in as another role, and I might have to actually exit out of this and come in through another. And I'm going to come in this time as an administrator. And now I'm in as an administrator over everyone. So now I can not just see Colleen Lopez's, but I can see every record for my organization. You'll notice I actually have some different features. I have the ability to populate in service providers, build additional organizations, add and edit users, add and edit what we call non-users, which may be team members that don't use the record but might want to get updates and information. I'm going to spend the majority of the time in a couple features. One of the things I didn't show you is all roles have a drop-down, and how much they see is going to be relative to their permissions. So this is another place where I can actually get in and edit, look at youth records or edit them, or work with actually all the data from a youth record, set enrollment requirements, and assign facilitators. So if I have more permissions, I'm going to have more functionality. The quick query is a feature that's really available to all roles, unless that allows you to work with an individual record or with all records. And it would allow anyone at any time in any role to ask some simple questions of the data. It's one of the ways you can export data. I'm just going to say I want to look at some information on complete demographics, including family members and including school. I want all genders. I'm going to leave pretty much everything open, and I want just to look at cases closed. We're going to be doing an analysis of demographics of closed cases, and so you can see I have no case closed. I'm going to say we're going to do an analysis of all enrolled cases, and it's going to allow me to, depending upon my access to data, it's going to allow me to pull content in numeric and text values, and then like preview and output. In this case, what I'm going to be seeing is an Excel file of data. And so if in fact I need to send a report as a facilitator on all enrolled youth, and they want to know certain aspects of their demographics, I can do that. I can email this report, and I can send it to relevant parties. I can do this also with assessment data, basic demographic data, and this again is how our email feature works. Again, I have to have permission, and those permissions include multiple levels and encrypted security that are HIPAA and FERPA compliant. If I go back out to the menu and I go to Quick Query and I go to Assessments, and I want to just work with one youth, I'm going to go in and go back to our friend Esther Hernandez, and I'm going to look at some of her CANS data. We're also redoing presently all of our search features, because I can't spell.
Hey, Kelly, while you're spelling Esther, we have a couple interesting questions. One is, would each provider, I assume that means each provider in the network, need to have a subscription to the software to use the system?
Would each provider in the net, so are you saying you're the care coordinating organization, would each of your providers have to have a subscription? Is that the question? And the answer is no.
Reading it from the bulletin board, I think that is the question.
Yeah, the answer is no. We are launching a provider portal that will have a lot more sophisticated features that would actually even allow your providers to, like, you know, if you think of yourself as a nucleus and having these arms and tentacles off of this system, the provider portal will also be available to anyone that you enroll as a provider. They could receive at no charge, they could receive referrals, they could send back referrals, but for them to actually work with the record in any capacity above and beyond the provider organization, yes, like they would need it. So what does that mean? Well, if I want to actually adjudicate a claim against a record, if I want more sophisticated functionality, I can receive referrals from your organization and 10 others in my community. I would have what we would call the provider portal and behavioral health provider setup that would allow you to pull down those referrals and manage them across multiple organizations. That would be a charge. Just interacting with the record under your purview would not. So I'm going to actually just, for the sake of time, again, I just wanted to really show you, I'm going to pick Esther Hernandez, and then I'm going to look at her available assessments. I'm going to quickly just show you a CANS report, and then I'm going to just show you, I'm going to go in here, I'm going to pick her CANS, and I'm going to say I want it in a graphical report. I want first and last, You can actually de-identify by checking here. It'll give you an output with no identification, or you can include additional identification, the facilitator and the enrollment status. So I'm going to quickly pull out this report, which is a CANS report that really just shows you those ratings by life domain areas at baseline and present. And you can save this, you can to a file, to the youth record, which is that repository, or you can email it. There's several ways to ask questions of your data. The quick query is the quick way to ask the questions of one or more youth and their demographic data or assessment data. We have a very sophisticated report builder feature that we license, and really we encourage for a few key people to be developers. Once reports are built, they're stored in a report library this is my crazy demo report library, which has more reports in it than anybody really needs. But what do those look like? I can take a look at duration, and I can build a report, and all these reports have been built in our report builder, and I'll show you that really here in a real quick second. I'm going to kind of minimize that. Family satisfaction, duration of care, POC amount paid by month. I'm going to pick this one, and it's going to repopulate it. And what it does, this is a report that was built in the report builder by selecting the variables and dropping and dragging them. I'm going to show you that in a minute. So it starts to show you POC amount paid by month. You get to title it. You get to decide what variables. You pick your color schemes. So you can see across this organization, this is the trajectory of all records as identified by the variables in this report. Let's say I built this last month. I can set this to run on a schedule and be emailed to funding sources. I myself want to know what these data are. I can go in and update them. And so there's many ways to, you can print this report out and email it. So how difficult is it to build this report? I mean, this report is basically built against the table structure of the database. And it's built by, pulling in variables of data that are relevant to you. Looks a little whacked out, so I'm going to actually go back in here and go into reports and go into create a report, which I think might be a better example. The report builder basically allows you to pull in data that is relevant. I'm going to pull in some demographics, and I'm going to pull in the core assessment of family satisfaction, and I'm going to pull in something, anything you really want, critical incidents, and I'm going to continue to my fields. And when I do pull those in, and I don't know if I pulled them in correctly, those fields all would populate over into this, and then I can continue to a summary of the report that would quickly allow me to build the report of the variables of interest. It's a very sophisticated feature that's relatively easy to train and use. You can also create and publish dashboards to different levels of access, the same with the reports. I know we're running out of time and I want to get to the questions, so quickly we have a whole service provider setup section. We have a massive administrative section that allows you to pretty much define the entire setup of the system, share resources across multiple sub-organizations. That would be you'd have a master setup and share them. Your assessment and workflow builders are in here as well. I think I'm going to stop there because it is a lot of information to try to impart in a short period of time, and I'm mindful that sometimes the most fruitful thing to do at this point is to try to be available to answer questions. So yeah, I guess, or however you want to handle it next, Eric.
Well, I think that there's really not that many questions, which is fine.
Okay.
The next question is there a minimum number of users per subscription?
There is not. We have organizations with 4 users, and we have, like several hundred users. So there isn't. We really want to be flexible to work with small, medium, large organizations.
And 2 questions have come up, not surprisingly, about costs. And one is a follow-up question to the last one, which is, can you discuss cost for subscription and length of time for implementation? So I guess that means how long does it usually take to get set up and folks trained is what I'm guessing there. But there's another question that is related. Maybe you can cover all these things now. How can I learn more details about the software, including record limits, the ability to extract data related to my program, and costs? So maybe talk a little bit more first about the method through which social technology licenses the system and its user fees and timeline associated with it, and we'll get back to a couple of those other little questions.
So everybody's cost, I mean, there are structures of costs within the setup, within the subscription. The first set are what type of subscription do you want? Are you a small organization with less than 10 users? We have a small county in Oregon that, was able to take our record and basically for under $10,000 a year, use our record, have a few customizations, and have all the features that I shared with you. And that's, our 10 and under membership. Then it really depends upon from there what you need. If you're if you have multiple sub-organizations and you're in several states, you're going to need our enterprise license. I'm leery of giving cost just because we send out, what we do next is send out a cost worksheet, because it depends upon, do you want just a standard license? Do you want an enterprise, which really lets you set up as many copies of the software for use by as many sub-organizations to your organization as you want. So there's a sliding scale there. I want just what you're offering. I don't really want any customizations to. I want the enterprise, and I want about a 20% customization on the plan of care and on the demographics and some of the assessments. So what I can tell you is that we are, I think we're competitive with other vendors that are out there. Usually most people sell on a per user rate, our per user per month. It depends upon which one you're using, but can be as low as in the teens to as high as, if you only have 10 users and you're on our $10,000 plan, it's, comes out to be $1,000 a month. So it's kind of like a volume issue too. As you have more users, we're not going to consistently charge you that same rate. And as well, if you're a small organization, we're going to try to work with you so that you can still use our record. I would say that our average expenditure on customization is about $10,000 to $15,000, and that's, if you can think of that in programming time, that's about 100 to 150 hours of programming, which goes a long way in the system because we offer so much as a standard feature. The other cost, if you wanted data integration or meaningful use, there may be an additional cost for that. Why is that? It's because the meaningful use uses a health information exchange, and those exchange are third-party systems that actually charge us a monthly rate. So those, again, are questions that you would put, you would answer those questions on our cost worksheet. And pretty quickly after we receive that cost worksheet, usually within 72 hours, we can give you a cost estimate. We're working with a couple organizations right now where they send in their cost worksheet. I've met with, their board, their organization. They've been able to ask me very specific questions about the cost. I mean, our goal here really in setting up this product, I come from behavioral health. Even though I'm the CEO of this company, I still hold a clinical license. I've been in the field of research. I've known Eric since he was in grad school. So my intent, our intent here.
Kelly gave me my first job in Wraparound. My first real job, that is.
Yeah, our intent here is to create a product that makes a difference for the field and closes the gap between what's out there and what's needed. And so cost, cost, we're really trying to make the cost, such that people can use this system and that, we can pay for our overhead and our staff's time. What are the other questions, Eric? Somebody asked a question.
Oh, sorry, I was on mute there. We're seeing, let's see, is the information able to be shared automatically with other systems, such as Avatar and Medicaid? Always an important thing to know.
We do have the ability to communicate with state Medicaid, and we have so we can do it through two capacities. Either if you're talking about communicating through a claims adjudication with Medicaid, we do have an embedded feature through the administrative portal that allows, you know, they actually, if you're looking at the system, this is just a little overview, but it allows us to, you know, and we are set up just to do it in a few states, so, you know, this data exchange capacity is really through this screen right here that you're looking at. Do I want to exchange data with Medicaid? Do I want to exchange meaningful use HL7 data, or do I want to exchange third-party data? And this is really relative. The first is really relative to claims. The second is really relative to information sharing, which this HL7 doesn't just have to be used for meaningful use. If I want to just be able to automatically send data and integrate with my state Medicaid data files, we'd probably use this feature, and then this is third-party billing for third-party insurance. So we are set up to communicate. The data integration is done through a messaging capacity. I talk about it much like laying cable from this system to the other systems, and to the extent those systems are either set up to message back or that we can assist you in setting those systems to message back, we can actually communicate with pretty much any system that's out there. What are the other questions, Eric? For some reason, I can't really see them.
I was going to say we're beginning to lose a few folks. Maybe,
okay.
John, is it possible to hand controls back to John, or have John take controls back?
Yeah, I can give it back to him. We can do those last.
Sure. Yeah, let's do a couple more polls that are going to give us feedback on what you've heard about. And in the meantime, while John is doing that, Kelly, the other question that I see here that hasn't been answered possibly is, how can I learn more about the software, including record limits? I'm not sure what that, I guess it just means, well, what it says, record limits and the ability to extract data related to my program or organization. And while Kelly thinks about those, John, why don't you go ahead and launch the poll?
All right. The best thing would be there's going to be a slide at the end that's going to have my email address and Eric's, and you can contact either of us to set up a time to talk further about any aspect of the system, or to have a demo, or to have login privileges to one of our data populated demos. But relative to record limits, I'm not quite sure, but if you're talking about, you know, how large can the record be before I get charged more, you know, we feel pretty confident that a 20, you know, the size limit should be of the record is sufficient. I don't think that's what you're talking about, but you might be talking about what I can include in the record. Is that correct, Edwina? And you can certainly message me back. But I certainly would, the ability to abstract data from the record, there's like 5 or 6 different ways to easily get data out of this record. We are not a software system that holds your data hostage. You own your own data. You have access to it at all times at multiple levels. It's permissions driven. We have multiple export features. We can also create custom exports at a nominal charge and set them up for you if you want a unique set of data pulled from the record at any time. If I haven't adequately answered your question or anyone else's, please feel free to contact us via the information that will be presented at the end.
Yep. So we've got about half of the folks who are still on voting. If you could vote, you can pick as many of these as you like. What aspects deem appealing or important? Facilitating data-driven supervision, producing high-level reports on outcomes, serving as an electronic health record, interoperate with existing data systems, and customization to my program. All of those are features built into TMS-WrapLogic to help us know what to focus on. Hearing back from you all about what's important is very useful. So take one more minute to vote. So I think similar to what we've seen from other need sensing data collection we've done for the system, folks are very keen on the flexibility and customization. Almost equally as important is the data-driven supervision and high-level reporting. Less important, but still around 50%, is the interoperability and serving as an electronic health record. So thank you very much for giving us that feedback. John, if you could do two things while we see if there's any more questions, which we only have about another few minutes. If you could put the last slide with our contact information on our PowerPoint back up. This is the answer to one of the relatively straightforward questions, which is how can we get more information? If you are interested in learning more about the system and its functionality, you should probably contact Kelly. If you're interested in the alignment of the system with the NWI practice model or the ongoing research agenda that we have for the system and the software, you might want to contact me, Eric Bruns. And I think that both of our contact information is now up there. So feel free to email us. I do believe that we will be putting this demo and webinar on the NWI archive. Is that correct, John? We've recorded today's session.
Yep. This session and the slides will also be available on the NWI website. That's nwi.pdx.edu. And then you would just toggle over to our resources, previous webinars, and you'll have it.
That's great. And we're going to ask everyone who's still on to do us one more favor, and then we'll look and see if there's any more questions that have come through. Launch that last poll, John.
Okay.
And the last poll is essentially asking folks, again, this is really useful for us to help us try to continue to evolve the system in the right direction. What do you think would be your initiative interest in the software? And the options that you have are to say that you think that, for those of you who are affiliated with wraparound initiatives or are part of one, tell us whether or not currently your program, agency, or initiative would likely have interest or not, and what reason you may or may not have that interest. So that poll is up now for you to choose one option. And again, this is just helping us try and do the best job we can to get what's going to be needed by the field out there. While you're voting, just a couple other notes. I do believe that there also are some more nuanced and detailed demos, as well as some more straightforward walkthroughs of the system that you can email Kelly to get access to if there are others in your organization that you want to share this information with. So let's take a look at our results. So currently, it looks like among the attendees who are still with us and voting, about 2/3 say that they would have some sort of high interest, either because they do not have currently have a system, or it looks like this could be an improvement or add function, and about, well, actually about 44% who say that we're not currently in a position to consider the IT system. And then the last option here is the one that is really the point of all of our work on this, which is that only 13% of attendees say that they have an IT system that currently meets our needs. And again, our perspective here is that meeting the needs of a wraparound initiative or provider organization entails both ensuring that you have a health information technology system that achieves all the basic functions of an EHR for any health or behavioral health provider, but also provides support to the very specific needs of a wraparound facilitator and wraparound agency, including managing all of that information about team members, team meetings, being able to develop plans of care with strategies from the service and services from the service array and so forth. And so, yes, it is very much consistent with what we've perceived in the field, that a very small percent of wraparound organizations say that they have an IT system that actually fully meets their needs. Let's see, do we have any other questions that have come through in the last couple minutes here? Okay, so some of you have gotten some individual responses from Kelly. Please feel free to email either of us if you have additional questions or comments. Kelly, any closing thoughts from yourself?
No, I'd like to thank you for attending today, and if you have any additional questions, please feel free to contact me.
I can't hear Kelly if she's talking.
And or just receive your general feedback.
It sounds as though Kelly was on mute or not.
Oh, my microphone was on the top of my head. Did you hear me at all, Eric?
Not really.
No, okay. I just wanted to thank you all for attending today. I appreciate your participation. You can reach me at the email address on the screen, and please feel free to contact if you'd like additional information or a demo, or just to provide any input that you might have on further shaping the system to more closely align to high fidelity wraparound.
Thanks everybody for participating today, and best of luck. Have a lovely Tuesday. And thank you, John, for facilitating as always.
Thank you.
Thanks, folks. See you later.
Bye.
Bye-bye.